All right, welcome in everyone. We're diving deep into acute coronary syndrome today.
ACS.
ACS, you got it.
Yeah.
I know a lot of you are really interested in getting right to the heart of these complex topics.
Mhm.
And ACS, I think, can sound pretty intimidating,
Yeah, it does.
but it doesn't need to be. We're
Right.
going to break it all down with our expert here today, who is amazing
Oh, you're too kind.
at connecting that medical knowledge and making it really clear how we can apply this stuff to our everyday lives.
Yeah, try.
And you might be surprised to learn that the warning signs can be really different,
Oh, yeah.
especially for women or for people with diabetes.
Absolutely. Yeah, that's a great point to start with because, we always see these movie portrayals of these dramatic heart attacks,
Right.
but the symptoms don't always present that way.
Right.
And that can make ACS even trickier to recognize.
Okay, so let's ditch the drama then and get to the facts. What exactly is acute coronary syndrome?
So ACS stands for Acute Coronary Syndrome. And it's not really a single disease, but
Yeah.
it's more a group of conditions that share this one common problem, which is a sudden drop in blood flow to the heart.
Okay.
So if you can imagine like a traffic jam
Oh.
in your arteries,
Okay.
except instead of cars, it's oxygen-rich blood that can't reach the heart muscle.
So it's like the heart supply chain is getting disrupted.
Yeah.
And we know that that's bad news for any organ.
Of course, yeah.
But you said ACS covers a few different conditions,
Right.
not just like a classic heart attack.
Yeah, so think of it as like a spectrum.
Okay.
On one end, you have unstable angina,
Okay.
which is this chest pain that just comes on suddenly. It might get worse,
Yeah.
but it doesn't cause permanent damage to the heart muscle.
Okay.
Then you have the two types of heart attack, which is NSTEMI and STEMI.
Got it.
These are more serious
Yeah.
because they do involve damage to the heart muscle. But they differ in severity
Yeah.
and how they show up on an ECG.
Okay. So understanding these distinctions then is important for medical professionals.
Of course, yeah.
But it's also important for, anyone who's advocating for healthcare policy or researching trends in cardiac care.
Absolutely.
Knowing that ACS is this umbrella term kind of helps make sense of those different levels of urgency
That's right.
and the treatments needed.
Absolutely. It really
Yes,
is.
it also kind of, I guess, highlights the importance of early diagnosis and intervention.
Oh, 100%, yeah.
The sooner we can identify, the specific type of ACS, the better chances we have at minimizing damage
Yes.
and improving outcomes.
Yeah, for sure.
Which brings us to the root of the problem.
Yeah.
What causes those arterial traffic jams in the first place?
So the most common culprit is something called atherosclerosis, which is the buildup of plaque inside the arteries.
Yeah.
So these plaques, they're made up of cholesterol, fat, and some other substances that kind of stick to the artery walls over time.
So it's like a slow motion buildup that can go unnoticed for years.
Yeah, exactly.
What makes those plaques suddenly rupture and cause a major blockage?
So you can kind of think of it like a volcano erupting.
Oh, okay.
So those plaques, they can become unstable,
Right.
prone to rupture, which then triggers your body's repair system to kick in.
Okay.
But the repair mechanism actually kind of backfires. So your body forms a blood clot at that rupture site, which unfortunately makes the blockage even worse, cutting off that blood flow to the heart.
So our bodies are trying to fix things, but sometimes create problems in the process.
Sometimes, yeah.
That's fascinating and a little scary.
Yeah.
But you mentioned that there are other causes of ACS beyond just that plaque buildup, right?
Right. There's some less common causes,
All right.
like coronary artery spasms.
Okay.
So this is where the arteries constrict suddenly, and certain drugs like cocaine can trigger ACS
Oh, wow.
because the effects they have on blood vessels and heart rate.
So it really highlights that ACS is complex.
Absolutely.
With a variety of potential triggers.
Yeah, definitely.
So knowing that time is of the essence with ACS.
Yes.
Let's talk about the warning signs.
Okay.
What symptoms should we absolutely not ignore?
You're right to emphasize urgency
Mm-hmm.
because recognizing the symptoms of ACS early
Right.
can make a huge UZE difference in the outcome.
Right.
So while chest pain is, the most well-known symptom,
Yeah.
it can present in different ways.
Okay.
It could be a crushing pressure, it could be a burning sensation,
Oh, okay.
or even just a tightness in the chest.
So it's not always like that dramatic clutching your chest moment we see in the movies?
No, not always.
Are there other other subtle signs then that might point to ACS?
Absolutely.
Okay.
So pain that radiates to the arms, especially the left arm, neck, jaw, or back. And then you have shortness of breath, nausea, vomiting, cool sweats, dizziness, and even fainting.
Okay.
These can all be signs that, something's seriously wrong and you need to get immediate medical attention.
It's like your body's trying to send you that SOS message, but it's not using like the most obvious language.
It can be subtle.
Yeah. And this is where things get really interesting, especially for you, dear listener.
Yeah.
We mentioned those atypical symptoms earlier, and they're especially common in certain groups like women, the elderly, and people with diabetes.
Yes, that's right.
So these groups often present with symptoms that don't fit that classic heart attack picture, which can lead to delays in diagnosis and treatment.
Absolutely.
So let's dig deeper into that.
Okay.
What makes these groups more likely to experience those atypical symptoms?
So in the case of women, it's partly due to the fact that they tend to develop heart disease later in life than men, often after menopause, when those hormonal changes can impact their cardiovascular health.
Okay.
Plus, they're more likely to have blockages in the smaller arteries of the heart, leading to more subtle symptoms.
So if the blockage is in a less critical artery,
Right.
it might not cause that same like dramatic chest pain.
Right.
But how do we distinguish then those subtle signs from just everyday aches and pains?
Yeah.
What specific symptoms should women be on the lookout for?
So fatigue is a big one.
Okay.
A lot of women dismiss it as, stress or being overworked.
Yeah.
But persistent, unexplained fatigue, especially when it comes on suddenly or worsens with activity, could be a sign of ACS.
So it's about paying attention to those changes in your body.
Yeah.
And not just brushing it off.
Exactly.
As part of getting older or something. What other atypical symptoms are common in women?
Back pain, indigestion, and shortness of breath are also common in women experiencing ACS.
Okay.
And they might feel just a sense of unease or anxiety that they can't explain.
So it sounds like the key takeaway here is to trust your instincts.
Yes, 100%.
If something feels off, even if it doesn't fit that typical picture of a heart attack, it's always better to err on the side of caution.
Absolutely.
And get checked out.
Yeah, early detection is crucial.
Yeah.
And it all starts with being aware of that potential for atypical symptoms.
So now let's say someone is experiencing these symptoms.
Okay.
What happens next? How is ACS diagnosed?
So think of it like a detective piecing together clues.
Okay.
Doctors use a bunch of tools and techniques to kind of build a picture of what's going on in the heart.
So it's not just one single test.
No.
That gives you a definitive answer.
Not one test.
Okay.
So the first step is usually an electrocardiogram or ECG. This records the heart's electrical activity.
Okay.
And it can reveal patterns that are indicative of a heart attack.
Yeah, what about blood tests?
Oh, yeah.
I've heard those play a role as well.
Absolutely. Blood tests are essential, especially looking at something called troponin levels.
Okay.
So troponin is a protein that gets released into the bloodstream when the heart muscle is damaged.
Okay.
So if those levels are elevated, that's a strong indicator of a heart attack.
Interesting.
Yeah.
So the ECG gives us like a snapshot of the heart's electrical activity.
Right.
And then troponin levels tell us if there's like actual muscle damage.
Yes.
Are there any other tools in this diagnostic toolkit?
Yeah. So imaging techniques like echocardiography can be super valuable.
Okay.
They use sound waves to create images of the heart.
Okay.
So doctors can actually visualize blood flow and assess the extent of any damage.
So it's like they're looking at it.
Yeah, they're seeing it.
In real time.
Yeah, basically. Sometimes a coronary angiography is needed.
Okay.
This involves injecting dye into the arteries to get a more detailed picture.
So we've got the ECG, blood tests, and imaging techniques all working together to paint that clearer picture. So it's what's going on.
Yeah.
What happens once ACS is diagnosed?
Okay, so the primary goal of ACS treatment is to restore blood flow to the heart as quickly as possible.
Okay.
To minimize damage.
Okay.
And there are several ways to achieve this.
Okay.
Depending on the severity and type of ACS.
This sounds intense.
It can be, yeah.
What are some of the immediate steps then that are taken to restore that blood flow?
So medications are often the first line of defense.
Okay.
Aspirin, for example, helps prevent further clotting.
Okay.
while nitroglycerin works by relaxing and widening the blood vessels.
Sure.
So that improves blood flow.
Got it.
Other medications like anticoagulants and beta blockers can be used to further manage clotting and reduce the strain on the heart.
So it's like a multi-pronged approach.
Yeah.
Using different medications to address different aspects of the blockage.
Exactly.
But what about actually reopening those blocked arteries?
Right.
I've heard about procedures like angioplasty and stents.
Yeah.
Do those come into play here?
Absolutely. These are what we call reperfusion therapies.
Okay.
They aim to physically open up that blocked artery.
Okay.
So angioplasty, also known as percutaneous coronary intervention,
Okay.
PCI, is a minimally invasive procedure.
Okay.
Where a thin tube with a balloon on the tip
Okay.
is threaded through the artery to the blockage.
It's like a tiny plumbing job.
Yeah, exactly.
But happening right inside your arteries.
Yeah.
Tell me more about how it works.
So the balloon is inflated to open up that narrowed artery,
Okay.
and then often a stent, which is a small mesh tube,
Right.
is inserted to keep the artery open long term.
Okay.
This helps restore blood flow
Okay.
and prevent future blockages.
It's amazing how far medical technology has come.
Oh, yeah.
But what about cases where PCI isn't an option? Maybe the blockage is too complex or it's in a hard-to-reach location?
Right, in those situations, or when time is really of the essence and PCI isn't immediately available,
Okay.
we might use thrombolysis.
Okay.
This involves injecting clot-dissolving drugs directly into the bloodstream
Okay.
to quickly break up that blockage.
So it's like a race against time?
It can be, yeah.
With doctors using all the tools at their disposal to get that blood flowing again?
That's right.
But what about severe cases where multiple arteries are blocked?
So in those complex cases, we might have to do coronary artery bypass grafting,
Okay.
CABG.
CABG.
This is a more invasive surgical procedure
Okay.
where a healthy blood vessel is taken from another part of your body
Oh, wow.
and used to create a detour around the blocked artery.
That's some seriously impressive surgery.
It is.
It really shows how serious ACS can be. And the lengths that doctors go to treat it.
Definitely.
But before we wrap up this part of our deep dive,
Yeah.
I want to shift gears a bit and talk about prevention.
Sure.
Because as incredible as modern medicine is, wouldn't you agree that preventing ACS in the first place
Absolutely.
is the best approach?
100%, yeah.
So what can our listeners do to protect their heart health and reduce their risk of ACS?
So a lot, actually.
Okay.
Many of the risk factors for ACS are modifiable through lifestyle changes.
Okay.
So this includes quitting smoking,
Okay.
managing blood pressure and cholesterol levels through diet and exercise,
Got it.
and being mindful of your alcohol consumption.
So it sounds like a holistic approach to well-being, focusing on healthy habits and mindful choices.
Yeah, exactly.
And if you have existing conditions like diabetes, following your doctor's recommendations for medication and lifestyle management is key.
Absolutely, yeah.
So prevention is an ongoing journey.
Yes, it is.
Not a destination.
It's not a one-time thing.
Right.
Yeah.
Small, consistent steps can make a world of difference in protecting your heart health.
Totally agree, yeah.
And that's a great place to pause for now.
Okay.
We've covered a lot of ground in this first part of our deep dive.
We have.
From understanding what ACS is and what causes it to recognizing the warning signs and exploring the various treatment options available.
Yeah.
We've also laid the foundation for understanding that crucial role of prevention.
Absolutely.
And empowered you with the knowledge to make informed choices for your heart health.
100%.
But our exploration of ACS isn't over yet.
No.
Stay tuned for part 2, where we'll dive deeper into those atypical symptoms and discuss some cutting-edge research that's changing the way we understand and treat this condition.
Yeah, I'm excited for that part.
All right. See you back here soon.
See? Welcome back to our deep dive into acute coronary syndrome. Before we move on, I want to circle back to those atypical symptoms we touched on earlier. They're especially important for you listening because understanding those nuances can be incredibly valuable, whether you're researching health trends across different populations or working on farm care policy.
Yeah, that's a great point. It's almost like a hidden danger.
It is.
When the classic signs of a heart attack don't always apply.
Yeah.
We talked about how women are more likely to experience those atypical symptoms, but why is that?
So for one thing, women often develop coronary artery disease later in life than men, typically after menopause when hormonal shifts can really impact their cardiovascular health.
So it's almost like a delayed onset,
Mhm.
which could mean less awareness
Yeah,
and potentially a misdiagnosis.
absolutely.
And to add to that, women are also more prone to a different type of plaque buildup than men.
Right.
They often have microvascular disease where the smaller arteries in the heart are affected.
Exactly.
That makes sense. If the blockage is in a smaller, less critical artery, it might not trigger that same intense chest pain that we usually associate with a heart attack.
Right, right.
But but what kind of symptoms should women be looking out for?
Fatigue is a big one.
Hmm.
A lot of women just chalk it up to stress or just being busy,
Yeah.
but persistent, unexplained fatigue,
Mm.
especially if it comes on suddenly or gets worse with activity, could be a sign of ACS.
That's a good reminder to listen to our bodies
Mhm.
and pay attention to any unusual changes, even
Mhm.
if they seem minor.
Even though they seem small.
Yeah.
Right.
What other atypical symptoms are common in women?
Back pain is another one that often gets overlooked. It's easy to dismiss it as muscle strain or bad posture. But if it's persistent, unusual, or accompanied by other symptoms like nausea or shortness of breath, it's definitely worth getting checked out.
So it sounds like trusting your gut instinct is key here.
Yeah, your intuition.
Even if it doesn't fit that stereotypical heart attack picture,
Right.
it's always better to err on the side of caution, right?
Absolutely.
Yeah.
Early detection can make all the difference. And it's not just women. We see atypical symptoms in the elderly and people with diabetes too.
That's interesting. Why are those groups more likely to have atypical presentations?
Well, think about it this way. As we age, our bodies change, and our perception of pain can become less acute.
Ah.
Elderly individuals might just attribute chest pain to arthritis or indigestion, or they may not be able to clearly articulate their symptoms.
So it's almost like those warning signals are getting muffled.
Yeah, they can be.
That's concerning,
That's
especially because older adults are already more susceptible to heart disease.
Right. And with diabetes, it's often about nerve damage.
Mm.
People with diabetes can actually develop a condition called silent ischemia,
Oh, wow.
where they don't feel any pain even when their heart isn't getting enough blood.
Silent ischemia.
Silent ischemia.
That sounds really dangerous.
It is, because without those pain signals, they might not seek medical attention until the damage is much more severe. Plus, diabetes often comes with other cardiovascular risk factors like high blood pressure and cholesterol, which further complicates the picture.
So it's like a perfect storm
Yeah.
of factors that can mask the typical symptoms of ACS, making it even more critical to be proactive about heart health if you have diabetes or other risk factors.
Absolutely. Now, I know you love exploring the cutting edge of research, so I wanted to shift gears a bit and talk about some of the exciting advancements that are happening in the field of ACS.
I'm all ears. What are some of the breakthroughs that are changing the way we approach diagnosis and treatment?
So one area that's incredibly promising is the development of new biomarkers for early detection of ACS.
Okay.
These biomarkers are like fingerprints in the blood that can signal heart damage, even before symptoms appear.
So we're talking about being able to predict a heart attack before it happened.
That's the ultimate goal. Scientists are identifying specific proteins and molecules that get released into the bloodstream during the very early stages of ACS, potentially allowing for earlier diagnosis and intervention.
That's mind-blowing.
It is, yeah.
It's like having a crystal ball for heart health.
It kind of is.
Are there any other research avenues that you find particularly exciting?
Another area that's gaining a lot of traction is personalized medicine.
Okay.
This involves tailoring treatment approaches based on individuals' unique genetic makeup and risk factors. So we're moving away from that one-size-fits-all approach to a more targeted strategy.
So instead of just treating the disease, we're treating the individual.
Precisely. By understanding a person's genetic predispositions, we can personalize their treatment plan, whether that's through medication, lifestyle changes, or even the timing of interventions. This could lead to more effective prevention strategies and ultimately better outcomes for patients.
It sounds like a true paradigm shift
It is
in heart care. Are there any other advancements on the horizon that you're particularly hopeful about?
Yes, There's a lot of research focused on developing new drugs and therapies for ACS.
Okay.
For example, some studies are looking at novel antiplatelet agents that can prevent clot formation more effectively.
Wow.
While others are exploring stem cell therapy to repair damaged heart tissue.
It's incredible to think about the possibility.
It really is.
It feels like we're on the cusp of some major breakthroughs that could dramatically improve the lives of people affected by ACS.
I share your optimism. The future of ACS treatment and prevention looks incredibly bright.
I think our listeners are feeling that same sense of hope and excitement. We've covered so much ground in this deep dive already, from the basics of ACS to the complexities of atypical symptoms and the amazing research that's shaping the future of heart care.
We have, and we're not done yet.
Oh, that's right.
In our final segment, we'll tackle some of the most common myths and misconceptions about ACS, helping you separate fact from fiction so you can make the most informed choices for your heart health.
Stay tuned for more insights and thought-provoking discussions in the final part of our deep dive. Welcome back to the final part of our deep dive into acute coronary syndrome. We've explored the science behind ACS, the different ways it can present, and even peeked into the future of treatment and prevention. But before we wrap up, we need to tackle something just as important: separating fact from fiction.
I'm glad you brought that up. Misinformation about heart health can be just as dangerous as the condition itself. It's time to debunk some common myths and empower our listeners with accurate information.
Okay, let's get myth busting. What are some of the biggest misconceptions you encounter about ACS?
One of the most persistent myths is that heart attacks only happen to older people. This couldn't be further from the truth. While age is a risk factor, ACS can affect people of all ages, even young adults.
That's such an important point. It's a reminder that heart health is a lifelong journey, not something we only need to worry about later in life. What other myths do you often hear?
Another common one is that if you're fit and active, you're immune to heart attacks. Again, this is not entirely true. While a healthy lifestyle definitely lowers your risk, it doesn't eliminate it entirely. Genetics, family history, and other factors can still play a role.
So even marathon runners,
right,
and gym enthusiasts need to be aware of the signs and symptoms of ACS and take their heart health seriously.
Absolutely.
Are there any myths specifically related to women and heart attacks?
Yes. Unfortunately, the misconception that heart attacks are a man's disease is still prevalent. This is just not true at all. Heart disease is a leading cause of death for women.
Wow.
And ACS affects them just as significantly as men.
We need to shatter that myth once and for all.
Yes, we do.
Speaking of misconceptions, let's talk about the idea that all heart attacks involve excruciating pain.
Okay.
We've discussed how symptoms can be atypical, but is it actually possible to have a heart attack without any pain at all?
You're right. Chest pain, yes, the hallmark symptom.
Yeah.
But it's not always present, as we talked about earlier. Individuals with diabetes are particularly at risk for silent heart attacks.
Right.
Due to nerve damage.
That's a sobering thought. It highlights the importance of regular checkups and open communication with your doctor, especially if you have, underlying conditions like diabetes.
For sure.
What other myths are out there that need to be addressed?
Another misconception is that once you've had a heart attack, your life is over. While a heart attack is a serious event, it's not a death sentence. With proper treatment, lifestyle modifications, and ongoing medical care, many people can live long, fulfilling lives after ACS.
That's a message of hope and resilience.
It is.
Now let's talk about diet and exercise.
Okay.
Are there any myths surrounding those in relation to heart health?
One I hear a lot is, I can eat whatever I want as long as I exercise regularly. Unfortunately, it's not that simple.
Yeah.
While exercise is essential for heart health,
right,
it can't completely negate the harmful effects of a poor diet.
So it's about finding that balance.
Yes.
Healthy eating and irregular exercise go hand in hand.
They do too.
Any other dietary myths you'd like to debunk?
There's a common misconception that all fats are bad for your heart. Well, it's true that saturated and trans fats should be limited.
Okay.
Unsaturated fats found in foods like avocados, nuts, and olive oil are actually beneficial for heart health.
It's about choosing the right kinds of fats.
Yes.
And focusing on a balanced, heart-healthy dietary pattern.
Absolutely.
Now, before we wrap up, I want to touch on something that often causes confusion.
Yeah.
The difference between a heart attack and cardiac arrest.
Okay, yeah.
Can you clarify that for our listeners?
Absolutely. So while the terms are sometimes used interchangeably, they actually describe distinct events. A heart attack happens when blood flow to part of the heart muscle is blocked, leading to damage. Cardiac arrest, on the other hand, is an electrical malfunction. It occurs when the heart's electrical system suddenly stops working, causing the heart to stop beating effectively.
So a heart attack is a plumbing problem.
You got it.
And cardiac arrest is an electrical problem.
Exactly.
That's a helpful way to remember it.
Yeah.
And while a heart attack can sometimes trigger cardiac arrest, they're not the same thing.
They are not.
Both are serious medical emergencies that require immediate attention.
Absolutely.
Well, I think we've successfully busted some myths.
Yeah, I think so.
And cleared up some confusion today. What are some key takeaways you'd like our listeners to remember about acute coronary syndrome?
I hope they walk away with a better understanding of what ACS is, the range of symptoms it can present, and the importance of early detection and intervention.
Early action can truly be life-saving.
It really can.
What else should our listeners keep in mind?
Prevention is paramount. Adopting a heart-healthy lifestyle, including a balanced diet, regular exercise, stress management, and addressing risk factors like high blood pressure and cholesterol, can significantly reduce their risk.
It's all about taking charge of your heart health and making informed choices.
Exactly.
And remember, you don't have to do it all at once. Start with small sustainable changes. Work closely with your healthcare provider.
Yeah.
And don't be afraid to ask questions.
Never be afraid to ask questions.
Well said. Knowledge is power.
It is.
And taking an active role in your health journey is the best way to protect your heart for years to come.
I agree.
Well, thank you for joining us on this deep dive into acute coronary syndrome.
My pleasure. It was fun.
We've covered a lot of ground.
We have.
But remember, this is just the beginning of your exploration. Be sure to check out the show notes for additional resources and links to continue learning about this important topic. Until next time, stay curious, stay informed, and stay heart healthy.